I'm Arden. I'm going to be your nurse today. Can I get you to tell me your name and date of birth?
My name is Lauren Juke. My date of birth is April 19th, 2005.
Okay, Lauren. So today we're going to be doing a cardiovascular assessment on you. I'm going to start with taking your vitals first, and then I can kind of jump into explaining what I'm going to be doing today. But before I take your vitals, could you go ahead and tell me, are you in any pain right now?
Nope.
No? So if you had to rate it on a scale of 0 to 10, 0 being the
0.
worst. Okay, so 0. Do you have any allergies, like to latex or anything like that? No? Okay, perfect. Well, I'm going to go ahead and get started on your vital signs. Go ahead and take your blood pressure. Get this. I'm going to palpate this artery real quick. Pulse right here. Perfect. That's nice. Get this nice and situated. I'm going to move your hair out of the way for you. Okay. Have you turn your hand like that? Oops, sorry. Turn it a little bit more. Okay. Get this situated. Yeah, if I could just have you put your arm kind of like that. There you go. Okay. Snag this in here. See if it'll sit like that. Okay, there we go. All right, I'm gonna have that, put that in your hand real quick. Okay.
There you go.
There we go. Okay, I'm gonna put that a little bit more in here. Okay, 126/82. That's good. Okay, I'll put that back in your hand. All right, I'm gonna write that down real quick. I'll get that off you. There we go. Okay, that Velcro is really sticky. All right, let me write that down real quick. Okay, now I'm gonna go ahead and take your pulse. Okay, how you hold your hand right there. Right. Okay, pulse is 82 and respiratory rate is 16. Okay, and I would also do a pulse ox on your finger, but I don't have one of those. But usually your range would be about 98. I'd also take your temp, but I don't have a thermometer with me. So today I'm going to be doing a cardiovascular assessment, and basically what that is I'm just going to kind of be listening to your heart, kind of inspecting you, and just stuff like that. But before we do that, I have a couple questions to ask you. Do you have a history of hypertension, diabetes? Do you have a family history of any cardiovascular diseases?
No.
Okay, do you have any sort of murmurs or palpitations?
I have an innocent heart murmur.
Okay, an innocent heart murmur. Were you born with that? Okay, gotcha. Do you have any chest pain at all, like when you're working out, or do you work out?
Yeah, but
every now and then. Okay. Do you ever like have any sleep apnea? Do you ever wake up in the middle of the night, kind of feel like you're catching your breath or anything like that? No? Okay, perfect. Well, so now I'm going to kind of get started with my assessment. I'm going to start with inspection. I'm just kind of looking at you right now, and I see that your skin is a nice even color, nice brown pigmentation all over. I don't see any paleness or cyanosis, blueness, or anything like that, which is good. I'm inspecting, and so I'm also going to be palpating around, just kind of all that. So I'm going to be palpating your pulses. I'm going to start like with your temporal up there. So I'm going to start kind of up here. Okay, +2 bilaterally. Yep, nice rhythm. I'm also going to be checking for jugular vein distension. So if I could just have you kind of like relax your head back a little bit. I'm going to look for that. I'm going to get my light out so I can check. Okay, no pulsations or distension. That's good. All right. I'm also going to feel your carotid pulses. Right, +2. I'm going to feel this one. Okay, +2. Right, perfect. I'm going to kind of move down now to your brachial right here. Feel those. Okay, +2, regular rate and rhythm. I'm going to move down to your radial right here. Okay, +2. Since I'm here, I'm also going to be kind of feeling your skin. Warm and dry to the touch, which is good. I'm inspecting over here. I'm also going to test for capillary refill. Okay, less than 3, that's good. And as I've kind of been looking at you moving down, I don't see any viscosities or any lesions or anything like that, any sores. Have you ever had any edema? No, you don't experience any of that. Okay, perfect. So I tested capillary refill. I would also kind of move down. I could do your femoral pulse and your popliteal pulse, but I'm going to check your pulse down here on your feet. Have you sit right there. I'm done this pretty quick. Those are good. +2 and strong. Regular rhythm. I'm also going to do capillary refill on your toes. Okay, less than 3. Perfect. All right, so now that I've done that, I'm going to kind of move back up to your chest. I want to feel kind of on your chest right here for any like heaves and thrills. I'm just going to put my hand right here in your pericardium. Okay, no heaves or thrills. I'm also going to have you kind of lift up your shirt right here just so I can look for any aortic pulsations or anything like that. Don't really see any. All right, so I'm going to, you can put your shirt back down. I'm going to feel around kind of where I'm going to be listening to. So I'm going to start feeling right here at your notch, okay, and I'm going to move down to the second intercostal space. Okay, that'll be the aortic area. And then I'll move across over here, pulmonic area. Okay, move down to Erb's point. Okay, and I'll move a little bit more down to tricuspid area. Okay, and if you want to kind of lift up your shirt, I'm going to kind of get under you. Okay, I'm going to move back down over your 5th intercostal space, kind of mid-clavicular line. Your apical pulse should be right around there. All right, perfect. So I palpated all those. I'm going to go ahead and I'm going to listen to the spots I just palpated real quick. I'm also going to listen with my bell, and I'll also listen to your carotid artery for any bruits or anything like that. Okay, I'm just going to find my spot again. Let's see where we were at. Okay, aortic area. Okay, regular rate and rhythm. Pulmonic area, regular rate and rhythm. Move down a little bit, right in here. Okay, Erb's point. S1 is very prominent. All right, I'll move down just a little bit more. Maybe a little uncomfortable. Tricuspid area. Regular rate and rhythm again. If I can have you lift up your shirt again, I'm going to get back down there. Find that 5th intercostal space. Okay. S2 is heard here. Get a little bit higher. See if I can feel that again. Sorry. I'm going to be kind of like up in your girl. There we go. Okay, so I'm going to listen to this for a minute. I'm also going to feel your pulse while I do that. Actually, I'm going to do this one while I hold that. Okay, 83, a regular rate and rhythm, and they were equal. I'm actually also going to listen with my bell now. Gonna go back, work the way I came. Just gonna listen for any murmur. You said you have a innocent murmur, right?
Yep. Can you hear it?
Let me see if I can. Okay, move back up here and come back down here. And there. Okay, back over here. All right. So I can faintly hear that murmur. Now I'm just gonna kind of listen now with my bell for any bruits or anything like that. Okay, on this side. Okay, no bruits heard. That's good. I'm also gonna check down here. Come back down, kind of to your legs. Just gonna kind of check for any edema. All right, no pitting. No pitting, that's good. All right, so I inspected everything. I palpated what I needed to, and I listened to your heart. I can kind of hear that murmur just a little bit. Do you have any questions for me? Any concerns about your heart or anything like that? Okay, awesome. Well, I am all done, so I will get my stuff. I'll go document that, and we can see the doctor soon.
Alrighty.
Thank you.